and welcome to the Cold Coffee Club, a podcast brought to you by Houston Moms. We're here to give you a little bit of that mom-to-mom connection, fun, and conversation amidst all the chaos. Join us as we take a break from doing all the things and explore the wide spectrum of this crazy motherhood role. We'll interview fun guests, talk about cool grown-up topics, laugh, share, and grow together. So go ahead, reheat that coffee, and put your feet up. Here we go.
Hello and welcome to the Cold Coffee Club. This is Ash.
We're leaving that in. You don't know who you are. We're leaving it.
Hello and welcome to the Cold Coffee Club. This is Jenny.
And this is Ashley.
I know my name.
So a few weeks ago, you didn't know your job title. Now you don't know your name.
And now I'm telling them your name.
Yep.
This is Jenny.
Yep.
And this is my co-host, Ashley.
Hello,
and
everybody.
We are so glad to have you here this morning. Ashley, spill the tea. What's going on in your world?
So my tea for this week, my win is that we went to the Museum of Natural Science this week. So they do a free Thursday every Thursday where you can go from, I believe it's 2 to 5, and you get to see all the permanent exhibits for free. But my fail in regard to that is that I did not prepare. So I thought that things like the planetarium were included in that. So the kids were all pumped because I told them about it, and I should never tell them anything until it's actually happening.
No.
And I was not about to spend money to take all 3 of them to the planetarium. So it's like, okay, sorry, I messed up. But they did really enjoy the exhibits, and my kids are really into, I did not expect this. We saw dinosaurs and all that, but what they were really into was the exhibit that shows you all kinds of like minerals and gems and jewels and all kinds of cool stuff. My kids are into Minecraft, so they're like, oh yeah, we could find this in the game, and they were so pumped about it. So that was a blast. So yeah, win is that we went and it was a blast, but fail is that I did not do my research. So yeah,
so that's every Thursday.
Yes.
You're saying from 2 to 5 you can go for free?
Yes. Yep.
I don't think I knew that. That's awesome.
Yes.
My kids love that museum. That's a great museum.
We haven't been in forever, and the butterfly exhibit is not included. The exhibit all about Egypt is not included, but of course, if you want to buy tickets for those, you can do that. Yeah. Okay. So yeah.
That's awesome.
How about your tea? Tell us your tea.
So I went last night to a spray tan party. Ooh. Which I don't know. A lot of people I didn't know that existed. I've been to a few before. If you've never seen a photo of me, I am a redhead and I am very pale. And so every time summer comes around, I just lack confidence in wearing like shorts and tank tops and things like that, just because I am, like if you think of like a whiteboard that you would like put on a wall, like a marker board, like that's the color of my skin tone. And so it's just like a real like glowy, translucent, like, but not like I don't know, just lack some confidence there. So there are women that have these businesses where they will spray tan you, like they just like spray you with it. And so, but sometimes if you go to like a party where the girl will like literally pop up a tent in someone's bathroom and you all show up, and it's the best kind of party because no one's wearing any makeup. And you're supposed to be wearing like a very loose flowing clothing because you're supposed to like make it to where like when you leave here, you're not going to be wearing like something tight. You're literally like walking out of there with no bra on. And it's also like, hello, spray tan lady. Nice to meet you. I'm naked. Yeah. But like, you're just standing there, like, and it's like, you can either, you can be totally naked or you can wear like, like dark panties, or like she has like paper panties you can put on.
Yeah.
You just like spray tan and then you walk back out and then like you wait overnight and then you shower the next morning. And I don't know, like I just feel more confident with a little bit of a tan. And when you get a lot of people, it like brings the price down. And so we had a wine and cheese situation. Mm-hmm. Everyone looked awful because like no one's wearing any, like, you're just like, what's up, girls? Like one lady walked in and was like, hey, I'm not wearing a bra. Like you're just like, what's up? It's like the best. It was so fun.
That's awesome.
I highly recommend it if you're someone that like just feels a little better with a tan. You're not going to a tanning bed where you're getting all of the harmful rays. And anyway,
Yeah. Was this a business that came to the party or like an individual?
It's an individual. It's a girl
Okay.
that like has like a little machine that she carries around. And so like, and you're in a tent and like, she's got like, you like step on these little like sticky shoes that you like walk in so it doesn't get the bottom of your feet. And she covers your feet with lotion and she covers your hands and
Oh, wow.
wear a little, like a little shower cap situation. I mean, she's got you covered.
Oh,
blow
wow.
dries you. I mean, you get real, you're like, and you're just talking the whole time. Like, so where are you from? Oh, and like, you're talking about like what, like, you know, what's going on with her kids. And, oh, my son went through that too. You know?
And it's just all out there.
Just yeah. You're just like, here you are, you know, just like, can you lift that? Like, okay. We are best friends.
Love it.
Anyway, it was a blast. So anyways, so what is your cream and sugar this week? What have you been enjoying? What have you tried lately? What's going on with you?
So my cream and sugar is an event that's coming up.
Okay.
That sounds awesome. I am a big time foodie. I love food. I am addicted to food and I have no problem with it. I don't feel like changing at all. The 2022 Houston Food Fest is happening on May 28th, starting at 2 p.m. And we have it. Yes, it is on our May guide. So look it up on May 28th. Okay. It is free for kids 8 and under. Everyone over 8 is it's $9 to get in. And it sounds like it's just going to be a bunch of like food trucks and all restaurants, all kinds of stuff from all over Houston, Austin, as far out as Austin and San Antonio are coming here. All kinds of food to try, and I will be there.
Yeah, no, that sounds great. That's my husband's birthday actually, and I think he would actually be
I swear Houston has the best food in the country.
We really do. We really do. I know it was funny. One of our readers once was DMing us about something. And she had moved here recently and I said, oh, where did you move here from? And she said she moved here from Charleston, South Carolina, which is one of my favorite towns. And I was like, oh, what a beautiful town. I love that city. And I said, this must be such like a shock coming here. Cause like, as far as like aesthetically, Charleston is a much more beautiful town than Houston. And she said, yeah, but y'all have better food here. And I was like, granted, we do.
Yes.
Okay.
What about your cream and sugar?
I have been watching a show it's on Amazon. I think it's actually on Stars or Showtime, but it's on Amazon Prime. If you have Amazon Prime, it's like on there. But it's called The First Lady. And it comes on Sunday nights. So it's not like you can't binge it. Like you have to wait till it comes on Sunday nights.
Okay.
And it's a scripted show. And it's following, like you're like jumping in time throughout time. And it's following Eleanor Roosevelt. Who is it? What is her name? Eleanor Roosevelt, Betty Ford, and Michelle Obama.
Oh, wow.
And it is like you're following like the three of them, like kind of as they are alongside their husbands, everything, excuse me, from their early lives through when they found out their husbands were running for office, through their early years in the presidency. And it's really neat because at first I was like, why those three? Like that seems like three kind of random women. But what I'm learning is that they were three women that were the first lady, but they were also very much in partnership with their husbands and were not just like, I'm here to pick out China. Look at, both in partnership in like the political world, but also in partnership in the marriage. It's really, really cool. And it's just the costumes are great and the scenery and like, especially like, just like looking at like what the White House would have looked like in that era. And it's really, really cool.
Oh, that's cool. That sounds right up your alley. And it sounds really fun. Yeah.
Really cool. Oh, okay. So we have an interview this week, which we always love when we have our interviews. And Ashley got to interview Dr. Nisha Mehta, who is from Wellspring Pediatric Dentistry in Katy. And they are just, May is National Dental Care Month. And so Ashley got to talk to her about just kind of taking care of our kids' teeth. And, it can be a little bit of a battle sometimes. So here's that interview. Go ahead and roll it.
All right, check it out. Okay, so we are celebrating National Dental Care Month. This is a very important month. I know that dental care is a huge deal. And so today we have from Wellspring Pediatric Dentistry, we have Dr. Nisha Mehta. And so welcome. Thank you so much for being here with me today.
Yeah, thanks for having me. I'm excited to talk about it because, of course, I'm real passionate about dentistry. So,
Yeah, of course. So tell us a little bit about yourself.
sure. So, I'm a board certified pediatric dentist. I practice here in Katy, Texas, at Wellspring Pediatric Dentistry. So, we specialize with just kids. I finished up my training in Chicago. So I went to the University of Illinois at Chicago, where I did my dental school as well as my residency. So we go through additional training to specialize with working with just kids.
Okay.
And so I did additional training in Chicago and then came out to Texas, and we've been here and love it here ever since.
Awesome. And how many kids do you have?
I have one little 2-year-old.
Oh,
And
fun.
he has his own share of dental things already going on.
Oh gosh, yeah. It's a lot to stay on top of.
Yeah, he's very
So
active.
yeah. So what issues can come from poor dental health?
Yeah, so the biggest one that most people think of is cavities.
Right.
A lack of brushing and poor hygiene at home. And obviously a combination of factors like diet can definitely impact teeth at any age, as young as a year old, all the way until 100 years old. So no one is exempt, unfortunately. No one gets a free pass. And so we just try to educate our patients on how to prevent things like cavities. Other issues that could be caused can include gum disease. So there's cavities, and then there's periodontal issues, which is fancy word for gum disease. And so we want to make sure we manage both of those because, of course, those can be chronic infections and chronic issues that can lead to, both of them can lead to tooth loss.
Mm-hmm.
We don't want that in kids or in adults.
Right. And is it true that poor dental care, like, problems in your mouth can extend outside of your mouth, like to the rest of your body?
It definitely can. There are correlations with your oral health and different heart diseases. There's different types of inflammatory responses that can be induced from poor oral health. Having chronic dental issues or infections in your mouth can definitely lead to facial swelling or even infections of the face. And so you have to really be careful with that, or even sinus infections. So we'll always stress prevention is key, because dentistry, it's kind of a gateway to your whole body. You eat through your mouth, you intake food and water through your mouth, and having poor health in your mouth can result in poor health in your body.
Right. Okay. So I know a lot of moms worry, or at least they're concerned about not knowing when to worry about their children. So my youngest was breastfed, and I noticed at a little over a year old that he was getting something at the top of his teeth. And I was like, what is happening? And, he was a big nurser. He nursed all day long. And we were very good at brushing teeth in the morning and brushing them at night. But when he was nursing at night, we weren't brushing in between, 4 a.m. feedings. And so there was a telltale sign that I should be concerned. What are other signs to look for that your children really do need some dental care and attention?
So always watching for, of course, changes, something that you have noticed that wasn't there before, or now it's changed. And there's something you're like, there's a spot on the tooth, or is that a stain, or is that a cavity? I always say just get it checked out. When in doubt, get it checked out. With the little kids, it's hard because they don't often give you a lot of time to look in their mouth. And so the first sign is something can even go undetected for a while, where parents didn't even know it was there. Of course, if a child is in pain, definitely have that addressed. But little things like stains on their teeth or changes in their enamel. So enamel is, everybody thinks teeth are white. Sometimes it can be a little bit off-white. So when you start seeing these very chalky white spots on your teeth, those can actually be indications of first signs of issues related to cavities. So we say if you notice any type of chalky white discoloration or yellowing of the teeth, maybe they aren't brushing well, definitely have it checked out, because that can lead to cavities or issues that we don't want to go undetected. Typically, if you come to the dentist every 6 months, they'll be checking for that. We say as soon as they have their first teeth, within 6 months, to have a dental appointment scheduled, or at least by the age of 1, so that once they're on that regular pathway of receiving the care, the dentist can keep an eye on and also give you tips on what to watch for.
Oh, perfect. Yeah. And so I know a lot of kids are very rough and tumble, like my children are. And like one of my children like smacked his face into the ground and it turned one of his teeth black. So I guess he like damaged the nerve or something. So I guess I'm really curious, at what point does trauma to baby teeth, cause issues to their permanent teeth?
So when damage to baby teeth, it can cause issues with permanent teeth if, for example, a tooth gets pushed in. So if they fall and they bump it and you notice it's kind of a little bit higher than the other one and you're like, oh, it wasn't like that before, definitely see a dentist soon. After trauma or bumping their front teeth, they can often get an infection on the tooth because the nerves don't heal and they don't recover. And that's when when we're a little more concerned, is if that infection stays in their mouth or goes untreated, that could potentially damage the developing tooth underneath. So watching for like a little bump on the gums, or of course pain, and following up. We always say after a fall, definitely come in at least to have a baseline check and make sure everything looks okay. And if there is something concerning, we can keep a closer eye on it.
Yeah. And I know you're a dentist. So what is your perspective on juice? How much juice is too much juice?
Yes. And kids will get their hands on it and that's all they will ask for. I have one on my own and he doesn't get it often. Of course, I'm a dentist. And so, but when he sees a juice box, he'll say, I want some juice. I want some juice. I'm like, oh gosh, she saw the juice box. It's hard to say no. It really is. So what we usually do is we do follow the recommendations from the American Academy of Pediatrics. So pediatricians recommend under the age of 1, really no fruit juice. They should have milk or formula as their primary nutrition. And so juice kind of dilutes them that down, and they may not be getting the nutrition they need to grow and of course develop. So we follow that. I definitely agree with that. Between ages 1 and 3, typically about 4 ounces or less a day. I always say if they are consuming that, consume it within a 20-minute period. So there's some kids that'll have like have 4 ounces diluted into 12 ounces or 8 ounces, and they'll sip on it all day long. While they're still getting the 4 ounces, which is what the pediatricians recommend, pediatric dentists go a step further and say that constant exposure to the sugars, even though they're low, and acid can weaken the teeth, making them more prone to cavities. So we'll say, just have it with a meal, 4 ounces or a juice box within 20 minutes, and then just water or milk between meals. And then as they get older, you can introduce a little bit more, like from age 3 to 7 or 6 or so, probably about 4 to 6 ounces. So really, kids shouldn't even be getting, under the age of 6, shouldn't even be getting more than half a cup of juice really a day.
Right. Well, that's good to know. I was a big advocate for watering it down. I thought I was making a huge difference and that it was better that way to just sip it all day.
It's not worse, but at the same time, it can potentially harm the teeth. So they're still getting the 4 ounces, but sometimes as parents, we're like, well, this 4 ounces will last them a little longer. So they can not ask for juice for just a couple more hours again. We'll take what we get.
Right. Absolutely. And so I know so many of us struggle with getting our children to brush their teeth. It's such a chore to them. I know we put it on our chore charts, and my grandma once asked me, why is brushing your teeth on your chore chart? That's a thing you just do. Like, yeah, but it's a chore to them. So any tips how to encourage your children to brush their teeth, take care of their teeth, want to floss? My kids absolutely hate flossing with a passion.
I would say make it a routine and make it like a family thing where it's not like an additional, oh, you have to brush your teeth. It's not a battle. It's like, okay, everybody, it's time to floss. It's time to brush. And, it's just a normal thing. Like everyone, we're eating dinner now. And so it's not like a chore, like you said, because a lot of times kids think it is, and they think this is taking away from my video games. This is taking away from my very important painting I'm working on. Why do I need to do this? And it's hard because you don't see the immediate effects. If you're hungry, you'll eat dinner and you feel full, you're happy. If you floss, you don't necessarily see that it's preventing cavities immediately, but it does over time. And so kind of making it a routine, doing it the same time every day. So eventually it becomes second nature, as opposed to a nagging reminder for kids. When they're younger, we definitely recommend assisting brushing. So kids maybe 6 to 8 and younger, helping them brush, at least even as they get a little older, at least just at nighttime. The indication is usually when they can tie their own shoelaces, they can brush on their own. So some kids at 6, some kids it can be later. And then flossing, definitely supervising through that age group and helping out. As they get older, you can make it even a little bit more fun and do brushing apps because it motivates them. They have little calendars on the brushing apps that will check off that they brushed twice a day, that they flossed. It'll even set a timer so that these electric toothbrushes are so fancy these days that they'll hook up with a Bluetooth, and on the app, it'll tell you, okay, you brushed for 1.5 minutes. Great. But next time do 2 minutes. It'll tell you, move your toothbrush here to here. So it can kind of make brushing a little more interactive and fun. That way they have that independence and they feel like it's their personal responsibility. If all else fails, I always like, especially for the older kids, these disclosing tablets. You can get them. They're these little tablets that you chew up and kind of swish around your mouth, and it stains the areas that you missed brushing like bright pink. So it's kind of a fun activity for kids to be like, okay, I have to get this spot. I have to get this spot. And they're watching in the mirror and they can really see the difference. So that way they feel they're getting that immediate reward of doing something productive. And then for older kids, when they're like, oh, I already brushed, and you're like, I don't even know if that toothbrush is wet. You can always say, okay, go chew a tablet and show me.
Yeah.
So they did brush, great, but maybe they'll be like, okay, I'm still missing a spot. And if they didn't brush, well, there's a visual for everyone. There's proof that they missed it. So there's different things you can kind of introduce to make it a little more fun. But ultimately, it's hygiene. It's like taking a shower. You have to take care of yourself. You have to brush your teeth and floss.
Yeah. Do you know where to get those tablets?
On Amazon.
Awesome.
Yeah.
I love
Amazon.
Amazon.
Amazon disclosing tablets.
Okay.
Dental disclosing tablets.
Awesome. And you mentioned electric toothbrushes. Do you have a preference, electric toothbrushes or traditional toothbrushes?
I don't have a preference as long as they're used properly.
Okay.
Ones that I always say to use caution with are battery operated electric toothbrushes, because sometimes the battery will slowly lose juice, which means the brush isn't rotating or vibrating with as much power.
Right.
And so sometimes if you forget to switch out the battery or switch out the brush every 3 months, you may be actually decreasing the efficiency of the brushing. The rechargeable ones are great. Either works well. And with the rechargeable ones, the same thing as a toothbrush, switching the head or the actual bristles with every season. So every 3 months.
Okay, perfect. Well, that's a whole lot to think about. And I'm planning out my Amazon order already. And my kids are due for a checkup. So we will definitely see you soon.
For sure. We would love to have them back. They're always a pleasure.
Well, thank you so much for sharing with us, sharing with Houston Moms and the Cold Coffee Club. We truly appreciate it.
Yes, thank you. And if there's anything that comes up, please feel free to send me a text or message. We're happy to help you guys out and happy to answer any questions. I know there's so many topics we can cover, but we hope to see your kids soon. And thank you so much for having me, Ashley.
Thank you. So that interview was super fun. Dr. Mehta is actually my kid's dentist, and she's just the sweetest. So thank you so much for joining us for that. We're going to roll on into our house blends for this week. Jenny, what is your Houston Moms house blend?
Yes, I loved this one. This was Rebecca Slocum wrote this called Let's Take an Adventure, Summer Books for Kids and Moms. And Rebecca wrote just a little summer reading list, everything from picture books to books for middle readers, some young adult novels, and then everything even on up to some books for mom to read. And I love, she wrote a really great little synopsis of each book, kind of what it's about. And my kids really love to read, and we're going to be doing the library reading list again this summer. And so I just loved having that. And I really trust Rebecca's recommendations because she always has really great recommendations. So check that out. That's we'll link to it in the show notes.
Yep, of course. So my house blend for this week, Lauren M. wrote a post titled "Breastfeeding Isn't Free or the Answer." And I just think with everything going on, it's so stressful, and so many people have strong opinions about like, well, why don't you just, and it would solve everything if you just did this. And it's like, no, there's so much more to it. And it's really none of your business. Like it's
exactly.
Yeah. So it was just a great way to kind of reflect, like before you say certain things or think certain things, maybe just, think about this perspective. And it showed a good amount of support for moms who are dealing with this formula crisis. So it was very helpful.
Well, and some people, I mean, it's really sad to say, but some people genuinely don't know that, like, I think it's been evident that there are some people, men or maybe just younger people, that don't understand that women can't just like choose to switch and go like, oh, I've been formula feeding and now I'm going to breastfeed. Like we can't just do that.
Not at all.
And I formula fed both of my babies, and I just can't imagine the stress I would feel right now. So it was a really great piece. Thank you so much, Lauren, for writing that. That was wonderful. Okay. So before we head out, do you have a see you later caffeinator for us today?
We have a very special see you later caffeinator, and that is that we really need y'all to like and subscribe and share our podcast. If you're loving this, if you're loving joining us every week, please tell your friends, like, subscribe, give us a little support. It means the world to us. So please.
It really does.
Yeah.
We would love it if you would. It does a lot for us. I mean, we're not just saying it like hit that button so that we feel good about ourselves. Like it's really good. Like it moves us up in like the podcast algorithms and stuff like that too. If you were to just, subscribe. So thank you so much.
Yeah. Thanks, guys.
See y'all next week.
Bye-bye.
Bye.
You've been listening to the Cold Coffee Club, brought to you by Houston Moms. We wish you a fabulous week with your families and look forward to sharing many more cups of cold coffee with you. One more read? You've been listening to the Cold Coffee Club, brought to you by Houston Moms. We wish you a fabulous week with your families and look forward to sharing many more cups of cold coffee with you.